It was crowded more than usual at the Guam Economic Development Authority's Board of Directors meeting today, and all for good reason, as the Guam Regional Medical City's qualifying certificate request was finally on the agenda. GEDA's Credit Review Committee, led by Christina Garcia, gave its recommendation for approval, saying Guamanians simply need GRMC services.
What we found in our analysis is that a number of the residents are traveling off island. A lot of those are because of these basic services, cardiology, oncology, endocrinology, are services not readily available on Guam.
The request calls for the corporate income tax rebate at 20 years at 75%, corporate dividend tax rebate up to 5 years at 75%, and the real property tax abatement for 10 years at 100%. She adds the abated tax revenue will pay for people who can't afford medical care.
Through our negotiations, through our discussions, GRMC has come to the table and they have agreed that they must provide care to everyone who walks through their doors, no matter their ability to pay.
She says the QC, meanwhile, doesn't just help the people but the island itself, as it increases Guam's credibility, as GRMC's application speaks to everything the QC program was intended to accomplish. She adds over 20 years they're looking at $170 million abatement compared to the projected $420 million in new tax revenue to Gov Guam. GRMC President and CEO Margaret Bangzung, meanwhile, gave her last plea, saying Guam's healthcare market has not been robust compared to U.S. and world averages.
So what this tells us is there's quite lots of opportunity for growth with respect to the Guam healthcare market.
Every year, she estimates 15,000 people and $65 million leaves the island for healthcare. She says the new hospital will bring in 130 new beds and hundreds of more jobs, and with the QC, it will help GRMC's mission to do both well and good in Guam. The biggest concern, meanwhile, from the board was the community contribution the hospital will provide. Board members like David John wanted to stick with a simplified formula for the contributions with dollar amounts opposed to percentages, adding this QC is much different than others.
This QC is also about jobs, but it's also about keeping dollars on an island that would have flown out, and most importantly, it's about quality of care for the community.
The board unanimously approved the QC request, subject to the changes on the community contribution to set dollar amount, leaving out the percentage allocations. This means the new hospital will do an annual contribution. In year 1, it will be $500,000. In year 2, it will be $750,000. From year 3 to 5, it will be $1 million. Year 6 to 10, it will be $1.2 million. Year 11 to 20, it will be $1.4 million. Those contributions will be brought to the board annually as to the use between healthcare to include Medicaid match and MIP payment, economic development and higher education, and cultural preservation. Immediately following the meeting, Bangzon was pleased.
Obviously very gratified and relieved somewhat that we can get past this now and really move to the important work of getting this hospital built and running and serving the people of Guam.
Reporting for Guam's News Network, I'm Ken Quintaniza.